If you are having pain immediately after you've gotten a tooth removed, then this is the right video for you. In this video, I'm going to discuss today about what leads to development of severe pain after a dental extraction, more importantly after a wisdom tooth extraction, and what is this dry socket. Let's discuss get into the video. Hi, I'm Dr. Salman Khan. Thank you so much again for coming back to my YouTube channel. If you love my content, do consider subscribing to my channel. It really motivates me to make more and more videos for you week on week, just real honest dental advice that I would give to my family and my patients. No marketing stuff. So I know it's painful, it's frustrating, it's irritating that although you got your tooth removed and still you develop pain. This is commonly known as dry socket. Let's find out what this dry socket is all about. As usual, I'm going to break down my video into different components. So this video will be divided basically into what is dry socket, how does it feel like, what are the causes of dry socket, what can you do to fix the dry socket, and what should you do if you already are suffering from dry socket. So in simple terms, once you get your teeth extracted, there is a clot form, pool of blood form. Sometimes this blood gets immediately dissolved and the clot gets dissolved, leading to an exposed bone and nerve in the area. This simple exposure of bone and nerve is painful because the nerve can feel everything, and this is known as dry socket. It's not an infection, but it's just exposure to bone and nerve, otherwise also known as alveolar osteitis. But what does this dry socket feel like? It feels like there is throbbing pain after a day or two. It starts, and then this pain does not stay in the extraction site. It radiates to your ear, your jaw, your temple, your forehead. The taste of your mouth changes. The taste is metallic, blood-like, and you start developing bad breath. And if you try to look into the mirror, suddenly you will see that the socket is empty. So you can see a big hole. So this means you have essentially developed a dry socket. Now, what generally causes dry socket? The number one reason for dry socket is smoking. Yes, you heard that right. Most of the patients immediately after extraction, your doctor must have strictly told you not to do smoke. So they start smoking or vaping or having a shisha, or after smoking, they must have stopped taking antibiotics. They must have stopped taking the post-op medications that was prescribed for you. The other reasons that can lead to dry socket is you're spitting too forcefully or you're vigorously rinsing your mouth. So these four reasons are very common for patients to develop dry socket. So here are simple 4 tips to avoid dry socket. First of all, avoid heavy lifting, avoid going to the gym, avoid doing any strenuous physical activity. Next, use a cold compress in that area. Like you can rinse, use a gauze piece, wet it in cold water, and you can just compress that area and let that gauze piece set and relax in that area for about 30 to 45 minutes. You can also use a cold compress. Take a cold cloth or take a hot water bag with cold water, and you can just apply, or you can apply an ice pack inside your mouth or around the jaw, and it will help control the pain. And most importantly, you need to eat soft cold foods. Ice creams are great, curd rice is great, and you can have pastas, salads, anything that is soft. You can even have dal chawal as long as it's not spicy and it is at room temperature. Now let's talk about what if you're already watching this video while having dry socket, so you cannot prevent it anymore. So if you're already suffering from dry socket, the best bet is go to the dentist. What they will do is they'll irrigate the area again with betadine solution, and after that they will change your course of antibiotics, and there is something called as an iodofoam gel or extraction socket gel that they will place it in the socket, and they will stitch that area and seal it for about 7 to 10 days. Yeah, healing takes about roughly 7 to 10 days. After that, you will start feeling complete relief. So don't panic. It is nothing sort of an emergency. Yes, I know it's bad, it's painful, but time will heal it out. You just have to sit this one out, and make sure you share this video with someone who has either gotten an extraction done or someone you know who is planning to get an extraction done. And in my next video, this is something that's really personal to me and close to my heart. I want to discuss in 5 minutes how to quit smoking. As simple as that. So stay tuned, do consider subscribing to my channel, and keep watching my videos week on week. Until then, goodbye.